appreciate the nature of behavior therapy, you must understand the model on which it is based. This lecture describes the general model of human behavior that forms the basis of behavior therapy. How do we define who a person is? What makes a person unique? What makes you unique? Well, according to the behavioral model, each of us is defined by our behaviors. In other words, by what we do. We are what we do. First, let us review overt and covert behaviors. There are two broad categories of behaviors, overt and covert. Overt behaviors are actions that other people can directly see or hear. In a sense, they are public behaviors. Examples include eating, walking, talking, kissing, driving a car, writing a sentence, cooking, laughing, and singing. Covert behaviors are private behaviors, things we do that others cannot directly observe. However, we usually are aware of them when we ourselves are engaged in them. There are three categories of covert behaviors. Cognitions include thinking, expecting, attribution, and imagination. Emotions is the second, and basically that is our feelings. And physiological responses such as muscle tension, heart rate, blood pressure, and respiratory rate. Overt behaviors like cognitions, emotions, and physiological responses contribute to four modes of behaviors that are assessed and treated in behavior therapy. Covert behaviors are no less important than overt behaviors. Assessing overt behaviors is relatively straightforward because they are directly observable. The covert behaviors of others are inferred from their overt behaviors. The other way we learn about someone's covert behaviors is by observing what the person does and inferring from their overt actions what is going on inside the person. Now, let's talk about behavioral versus trait descriptions. Let us complete this simple exercise together. Go ahead, grab a pen and scratch paper. Okay, ready? Here goes. Take 2 minutes to do a simple demonstration. Think of someone you know very well. Now, write a brief description of that person so that someone who doesn't know the person could get a feel for what they are like. Now, take a minute. Okay, when describing someone as you just did, most people refer to the individual traits rather than their behaviors. Traits are personality characteristics that we attribute to others and ourselves, such as friendly, smart, interested, and honest. Traits are inferred from behaviors. For example, when we observe someone holding the door open for people and stopping to let other motorists enter the flow of traffic, that's our behaviors. We infer that the person is courteous. That's their trait. It is important to note that traits are abstract concepts, not covert behaviors. Okay, I want to go over some examples of covert behaviors that serve as anchors for covert behaviors. So the overt behavior would be telling others what's on your mind. The covert behavior would be thinking. The overt behavior would be missing an appointment. The covert behavior is simply forgetting. The overt behavior is staring, winking one's brow, remaining motionless. The covert behavior would be concentrating. The overt behavior would be trembling, pacing, biting one's nails. The covert behavior would be feeling frightened. The overt behavior would be hugging, kissing, saying I love you. The covert behavior would be feeling in love. The overt behavior would be applauding, thanking, and the covert behavior would be appreciating. Now let's go over examples of overt behaviors that might indicate particular traits. The trait would be happy. The behavior would be smiling, laughing, talking about feelings of joy. The trait would be depressed. The behaviors would be crying, sitting alone, moving slowly, saying that one is depressed or down or unhappy. The trait would be friendly. The behaviors would be greeting people and smiling at others. The trait would be trustworthy. The behaviors would be arriving on time to appointments, for example, and carrying out assigned tasks and keeping secrets. The trait would be generous, and the behaviors would be volunteering to help others. Now remember, behavior therapists deal with clients' behaviors and not their traits. However, clients often describe themselves and their problems by using traits. For example, I'm shy and withdrawn. Thus, behavior therapists must translate traits into behaviors. This involves identifying the unique behaviors that are associated with clients' trait descriptions. The key question the therapist asks is, what specific things do you do that lead you to describe yourself? And as stated, a trait description may be associated with particular characteristics. Now remember, traits are personality characteristics that we attribute to others and ourselves, such as smart, friendly, interesting, and honest. Traits are inferred from behaviors. And in contrast, the behavioral model simply describes people in terms of their behaviors. Behavioral descriptions are specific and much more detailed than trait descriptions. Okay, I've got another exercise that I want us to complete together. So grab your pen and your scratch paper. Okay, ready? Here goes. If you are in a relationship with someone, I want you to go ahead and write down 5 traits of that person. Yes, 5. I know you're only thinking of 1 or 2, but I want you to really think about it and write down 5 different traits of that person. And then I want you to go ahead and write down at least 2 behaviors associated with those traits. And again, behaviors versus traits. Traits are personality characteristics that we attribute to others and ourselves, such as being smart, friendly, interesting, and honest. Traits are inferred from behaviors. And in contrast, behavioral descriptions are specific and much more detailed than trait descriptions. All right, guys, I'll see you in the next lecture.